Excellent. So we welcome you, Dr. Michael, to the Well Wave Now podcast and appreciate you taking time out of your busy schedule. I know you came right straight from working with a patient to hop on here, so it's great to have you on. So Michael and I have known each other for a little while because he's in my same industry with community pharmacies. And you're well beyond pharmacy, though. You are getting into functional medicine, and you've taken those extra classes to be a provider with functional medicine as well. But as we talk about genetics and what the individual's genes are, to make sure that our listeners really understand, I appreciate you giving the background on what a nutrient is and how fundamental that is. But let's jump into also your the gene side of this. So exactly when we talk about nutrients and what their role is and how they play on keeping the body healthy, let's see what ideas you have on, is it just general food that your intake, or is it the right nutrients that we're looking for? And you kind of alluded to that, saying we're not going to get it out of a donut, right?
Right. Yeah. So a lot of it is exactly, you're going to get it out of food, but even then, everything we consume is in the raw form and our body has to activate it, turn it on. Everything that we eat, we have enzymes in our mouth that start breaking down food. And then we have mechanical breakdown when we're chewing. Then we have a chemical breakdown inside our stomach. And then you have more enzymes that are released from the common bile duct. So there's a lot of processes in our body to start breaking down food as a whole to being able to extract the nutrients that we need. But everything that's created there must now pass through barriers, right, which our body has in our gut. And those barriers are there to prevent infection and to prevent, other issues. And we have good bacteria and bad bacteria in our gut. But then it gets to go to the liver. And once it enters into the liver, your liver has to be able to process these raw nutrients into the active form. And then that's where it becomes an issue. So a lot of the things that happen in our liver start to tell us whether or not we're turning things on or turning things off. Okay, so our liver is a filtration system. That's what a lot of us have learned in high school biology and stuff. But the other thing too, inside our livers, we have a lot of genes that are being turned on and off in our liver, right? So we have CYP enzymes that are there also. And CYP enzymes tell us how we're going to break down and detoxify things. And,
Dr. Michael say, what'd you call those?
CYP enzymes?
CYP enzymes. Okay.
Yeah, CYP enzymes, your cytochrome P450 system. Yeah, so CYP, it actually tells us how our body's going to be metabolizing different types of nutrients, toxins, drugs have to be converted at some point into an active form. What's the same thing that happens with nutrients, right? So if we're taking, let's just say sodium, right, and it's already in the raw form, it's in its single form that's going to get absorbed and we're going to use that. But let's just take something, for example, because we're talking about genetics, it's folate, right? You can get folate from food, right? So that our body needs to turn on folate, and that becomes methylfolate, right?
It's got to make
But
that
if you have
conversion, right?
it's a conversion that
Yeah.
happens, right? And genetically, you can have a deficiency that prevents your body from converting that folate or folic acid, which we'll talk about in a minute. But your body can have an issue converting that folate into methylfolate, and
So
that's an MTHFR SNP.
why is folate important?
Folate's important because it does a lot of different things in your body. So back in the day, when I was in pharmacy school, a lot of things that we learned about folate was you need it for prevention of neural tube defects in babies, right? It helps a lot with the brain. But another big thing with folate is it's part of a methylation cycle, right? So you have folate, then you have like methylcobalamin, then you have methionine, SNPs is another one, and then homocysteine. And methylation is important because one, it helps with your DNA, but it also helps with metabolism, right? So and detoxification pathways in the liver. Your methylation pathway is one of those. You have acetylation, glucuronidation, sulfation, different types of processes that are needed, and so that's why folate is important. Folate.
Dr. Michael, you gotta break that down for this simple country boy out of Nebraska as to what is methylation and what is that methylation cycle.
Yeah. Okay. So that is always the hardest thing. When I talk to doctors, when I talk to, these and nurse practitioners and stuff like that, and they're like, okay, so what is methylation?
Uh-huh.
And, when you look at it in just the methylation cycle, right? The way I like to say is like we're playing hot potato, and whoever has that methyl group is going to move things around, right? So when we're trying to methylate something, we want to give it somewhat of an energy source. It's not really energy because energy is like your ATP and stuff, right? But we're trying to transfer something which is called a methyl group, which is just carbon and 3 hydrogens, right? And so we're moving this energy around, and it actually helps activate these nutrients. It turns them on. But again, and then so that's what we're trying to do with the nutrients. But then it's like, but what is methylation? And methylation is not just one thing. So people say, oh, okay, well, if I'm turning something on, that's what I'm doing. Well, yeah, you're kind of turning on B12 by making it become methylcobalamin, right? Instead of cobalamin, which you're getting from just regular protein. But it's like, how do we turn it on? It's like, well, to get a better active form of it, you use methylcobalamin, right? So it's a conversion that needs to happen, but it's also a protection compound because it aids the detoxification in your body, right? So when we look at methylation, it's very complex, but at the same time, at the end of the day, when we're looking at it with patients, is like, are we getting the proper nutrient form that's needed?
What really is the impact of any nutrient deficient that you see? Now, you talked a little bit about the impact on babies forming, but let's say for a mature adult like Dr. Bob, if he's nutrient deficient, what could happen to him?
So, yeah, definitely. When you're looking at that, it can be different things, right? So there's a lot of symptoms that it can be. One of the symptoms that it can be is, ADD has been associated with the MTHFR gene mutation, right?
You
There's
better give those initials a little clarification there, please.
ADHD, attention deficit hyperactivity disorder is one, and then you can have Alzheimer's, dementia, autism has been associated with that. High blood pressure has been associated with the genetic SNP as well. Increased risk of cancers, increased risk of autoimmune diseases as well. I mean, even we have patients with Hashimoto's that have a genetic SNP and their body's not able to produce proper enzymes that are needed for methylation as well and for deiodinase enzymes to be produced. We've even seen fibromyalgia, where in traditional medicine, we're going to treat patients with serotonin or SSRIs or SNRIs, but a lot of times they're deficient in producing some of those nutrients. And so one of the big ones that happened for us is we had a patient that had a lot of anxiety and depression. The patient wouldn't leave the house. We looked at her hormones, we looked at her complete panel of blood work, and then we found out too that she was deficient in these methylfolate, right? Because she had so there's two different ones, right? MTHFR, there's a C677T and then MTHFR A1298C. She had the TT on the C677T. I like to tell providers whenever you look at the T in there, that means trouble. And that's the one that's going to produce the biggest effect, right? So if you see that T in there, we know for sure this patient's going to have some problems with methylation. What ended up being is we just gave her high dose methylfolate, which was 15 milligrams sublingually. And within 7 days, so this patient also would not leave her house. Her anxiety was so bad, she wouldn't leave the house. And after making that trocheon in 7 days, she was leaving the house.
And what do you mean, Dr. Michael, about sublingually? Is that oral medication?
It's oral. You put it underneath your tongue. You let it dissolve. It's a rapid dissolve tablet. It's better than doing oral sometimes because some patients can even have genetic issues that prevent them from absorbing B vitamins in their gut, or even sometimes some patients that have had like gastric bypass and other things as well.
Yeah, so
we can bypass.
Yeah, that brings up one of the questions I have, and I know the answer to the first part of it, right? That it's not enough just to take a multivitamin, but isn't it better to at least take a multivitamin than no vitamin at all?
yes and no. I would tell you, if you're taking a multivitamin, just like Essentium one a day, that is not enough. I can tell you that that is like a spit in the bucket of just trying to get the nutrients that you need. Some basic things that we tell patients is vitamin C, for example. You should be consuming around 500 milligrams of vitamin C daily at a minimum. And Essential one a day, you're maybe going to get 50 milligrams. Same thing with magnesium, minimum 200 milligrams of magnesium daily, and you need magnesium for over 300 chemical processes in your body. And with Essentium, you're probably going to get 10 milligrams of that. And we're saying, well, you need over 200, right?
Right.
Same thing, too, that you're going to see with like methylfolate, which Essentium doesn't have. Essentium has folic acid. You're only looking at 400 micrograms, and here we are treating this patient with 15 milligrams. Very high dose compared to that.
Yeah.
So vitamins are great, multivitamin, but making sure you're taking the right multivitamin is more important than anything. But then you also want to make sure that you are taking what I always tell patients, if it can be in the active form already, so your liver's not having to go under excess strain of trying to methylate, using like something that has methylfolate in it, as that's your B9, and methylcobalamin, which is your B12. So going into what are the differences, right? So B12 is, you have methylcobalamin, hydroxycobalamin, adenosylcobalamin, but then you can also have cyanocobalamin, and that's what a lot of these products use. And cyanocobalamin is a toxin that your body has to convert into methylcobalamin, right?
Mhm.
And so you're putting more strain on your liver if you're using that. Now, there are studies that show that if you give patients cyanocobalamin, it raises their B12 levels in their blood test. Yes, it does. Why? Because your body still has to break it down, and now you're adding more strain. So it helps your body keep the levels at a higher level. So if you want to do away with that, we need to actually give it in the correct form, and now you allow your body to break it down the way it's intended to. So I like the way my business partner likes to say it sometimes. He goes, it's like, you need, your car is a Ferrari, right? And you need to put more gasoline. If you put water in there, it's a liquid, but is it still gasoline? No, it's going to mess up your car. It's the same thing, kind of like what happens, right? With the cyanocobalamin, it just sits in your body, and then you just add more strain to your body when it's trying to detoxify.
Yeah.
So
Yeah. One thing that always comes to mind for me, this is almost a Dr. Bob tangent that I'm taking you on here. And it's okay if you haven't contemplated this, but I know also from our discussions and your backstory, which I encourage people to listen to, it really talks about how you got to this point and what you're doing, is that you're a man of faith, you're a man of God, and we talked a little bit about that. God has made provision and put everything on earth that we need. But when I hear these conversations sometimes, like we just went through, that the multivitamin is not enough and you need this and we're high dosing you, how do you think people got this before we came up with all these things? How you ever thought about that, Dr. Michael? How were these needs met before you came along and said these are your high dose stuff that you need to take?
yeah, no, and what people did back then, our food was so much different from what it is now. And
Yeah.
I'm a firm believer that everything that we need is already on this earth,
Yeah.
right? The way God made earth and the way God made us through, survival of the fittest and everything, I think the way that the things that we need are already here, but cyanocobalamin is man-made. It's not something that was here on this earth,
Okay.
right? So we ended up synthesizing this with big pharma and stuff.
Mhm.
And so we've created this way, but it's not something that our body naturally needs, nor is it anywhere found in nature. And that's the way I like to say is like these things that we're looking at and using is like, are they available in nature? So folate is in nature, but we need to be able to methylate it, and its genetics issues happen. There's even studies, and things where people try and go down the whole rabbit hole. It's like, okay, so what actually are people that are good methylators and those that are bad methylators, and which ones are prone to more diseases, and do those diseases kill them, right?
Michael, when you say good methylators and bad methylators, so what does that really mean? Does that mean that when they get something that needs methylation in their body, their body can do it well or not well? Is that what that means?
Yeah, so with good methylator means that their body can make active things like methylfolate, methylcobalamin, convert methionine over to homocysteine, right? So your homocysteine levels, you want to convert homocysteine into methionine. Homocysteine levels is very inflammatory. It's an amino acid in our body. It causes a lot of inflammatory responses, but you need to be able to methylate it to methionine to decrease that inflammatory response, right? And so sometimes some people just need added help to overcome that thing. But then there's also some people that don't need that help, that their body automatically will grab methyl groups from different areas and be able to convert those those hormone or the, not hormones, those nutrients easier than anybody else. So that's kind of like when we start looking at methylation processes and like where things are going through. That's the most important part. Is like, okay, so can your body do it? Do you need help, right? So like for me, I have the CT, so I have one of the SNPs, but if I take methylfolate at like a 3 milligram or even a 5 milligram, my cognition, my focus, everything is a lot more enhanced, right? Where you see people that have the 2Cs and they don't have any issues with some of these problems, right? But then that's just saying that's one piece. Because then, just like what we were talking about earlier, Dr. Bob, is like, but your environment also does other things to you,
Yeah.
Yeah.
you know? And so if you can at least just give your body the nutrients that it's possibly deficient in and seeing what helps, that's the start. And that's pretty much what we do is a lot of our multivitamins that we recommend to patients are already in the methylated form. Because you know what? If that's all it needs and that makes the biggest difference, there we go. Like we're in the right spot.
Getting that right nutrition through the already in a methylated form versus, is it more expensive to get it already converted?
Yeah, to get it already converted, it is a little bit more expensive than your traditional Centrum, pennies on the day. The way I like to say is like some doctors is like, yeah, you can go buy the Centrum. Is it going to work for you? It may work for some people. They're saying, what is it, like 48% of the population cannot methylate or poor methylators.
That's huge.
Yeah, it's
Yeah.
a huge percentage.
And so this one doctor, what he actually tells his patients, like, look, this is what I recommend that you take. If you want to take one from HEB, you're better off just going and throwing your money on the floor and walking out without taking anything, because a lot of those things are a lot more toxins than anything.
Yeah.
Great. So, Dr. Michael, now that we understand nutrients and we looked at why some people can't make them or use them properly, and we looked at genetics in there. But I want to understand. Let's give a little more understanding of the genetics, and for example, go into the SNPs a little bit and a little bit more on how they specifically affect that nutrient production and utilization a little bit.
Okay. Yeah, so SNPs are single nucleotide polymorphisms, right? So they're just variations within your genetic code that tell your body to produce certain things, right? Enzymes and stuff like that. So when you start looking at genetics, it's like, okay, well, genetically, there's different things. And the main ones that I like to look at is like, okay, which ones are actionable right now? And the ones I really look for are genetic SNPs looking at nutrients and production of those nutrients. So one of them is you got your MTHFR, which we've already discussed. And then you have the MTR and MTRR as well. And those work with the conversion of homocysteine back into methionine. Okay. And when we look at that portion right there is your B, right? And so you can have methylcobalamin, hydroxycobalamin, adenosylcobalamin. Those are things that your body uses, but the methylcobalamin helps the most with the conversion of that homocysteine into methionine. Or, you also need B6, which will help degrade your homocysteine down a different pathway. Okay. So when we're looking at those nutrients and those genetic issues, that's telling us which one's more important to that patient. Okay. So when I look at a patient's genetics, if you've done Ancestry.com or 23andMe, we can actually download that data, your raw data, and then we actually sequence that raw data, and then we come up with a treatment plan for the patient. And so we look at B12, right? So we've talked about that one. B9, which is your methylfolate. Then we're also looking at absorption of your B vitamins. How well does your body absorb them, right? And so we're able to look at that as well. How well does your body process vitamin D? So we have patients, that doctors always say, just go outside in the sun, let the sun convert, and there you go, you're getting your vitamin D levels. But we have patients that are always fishing, they're always golfing, they're always in the sun, but they have this genetic issue, and no matter what they do, their vitamin D will stay low. So then we're like, okay, genetically, we know your body's not going to do it. So you have to take a vitamin D supplementation to help them raise their levels, which, optimal levels of vitamin D should be above 50 for heart health and above 70 for cancer prevention, right? So we're always trying to raise patients to above that 70 to try and, reduce those risks. So then the other thing too, when we look at your genetic SNPs as well, is how well does your body convert tryptophan, which is what you consume on Thanksgiving when you eat turkey, right? So you get a high dose from there. Well, tryptophan needs to convert to 5-HTP, and you can have a genetic SNP called the TPH2. And if your body can't convert that into serotonin, now your patients will start having the anxiety, depression as well. So did their depression come from their low serotonin, or did it come from their methylation? And those are the things that we try to hit to try and raise those levels with them. We've even had patients with, Parkinson's syndromes, and their body's producing a lot more excitatory, not enough inhibitory, and treating them with 5-HTP, and now all of a sudden they're feeling much better. Okay.
Yeah.
And then we look at SOD2, right? SOD2 is another genetic SNP. This one is more dealing with oxidative stress in their body. So if you have a patient that is working out every day, they're not losing any weight, they don't know what's going on. It's like, well, they're working out too much because they're putting too much oxidative stress in their body, and it takes them longer to recover than a person that doesn't have an SOD2 SNP, right? So our genetics tell us a lot of things, and that's what we really focused in on. Which ones are the ones that are very actionable? Like, which ones can I fix now? Okay. Because if you can fix a lot of those things, and we can decrease oxidative stress, which when we start looking at neurological conditions and all these other things, that becomes a big portion. Even looking at diabetes, autoimmune diseases, if we can decrease that inflammatory response, we're going to have better outcomes with these patients.
So, Dr. Michael, for someone that may question whether or not they have a genetic SNP, what are some of the how does that appear? What are some of those things that might be symptoms that they're experiencing?
So the symptoms would be like the autoimmune disease stuff, right? So lupus, Hashimoto's, those are things that I would just say automatically start looking at. Anxiety, depression, are some big things. Patients that have, always work out and they can't lose weight. Sometimes that can be it. Fatigue is another big one. You'll see patients, but again, fatigue is so many different things that it can be. It can be a low functioning thyroid. It could be a poor gut system, right? If you're, not detoxifying, people that are not going to the restroom, multiple times a day. We have some patients that they're like, yeah, I go to the restroom probably every 3 days. And we're like, whoa, that's not normal. And it's like, we got to fix those things, right?
Yeah.
Then we got patients that have, they've been like, well, I take, Miralax to help me go to the restroom. I take Senna all the time. And now they have these lazy guts, and so we're trying to fix and repair their gut system. But when you start looking at these patients and start seeing, okay, what other symptoms do they have? The main ones I'll tell you that we look at are all the mental ones that you're going to see. Those to me are like the easy ones to pick up whenever you're having patients with a methylation issue.
I appreciate you covering that. In our next segment, we're going to actually address genetic gaps, and why there are particular gaps in your genetic that you may not be able to get the nutrition that you're needing or your body's needing. But before we go into that, I want to thank our sponsor for this half hour is BioLite. So BioLite is an amazing product that is the first of its kind that's actually a clinical hydration. So recent surveys indicate that about 75% of Americans are chronically dehydrated. Here in Arizona, it's probably closer to 90% because it's desert, right? But BioLite is the only medical grade hydration drink on the market. Everything that you would need or get through an intravenous IV, but in the convenience of a drink. So 650% more electrolytes than the leading sports drink. BioLite's family owned and on a mission to help people feel better fast. So BioLite's amazing. I wish I would have had this when I was back training for marathons.
Yeah.
Yeah, and we'll leave a link in the show notes. So back to these addressing these genetic gaps, for nutrient gaps. Some there's certain blocks, right? So what can actually be done about it?
What can be done is we just give you what your body is supposed to be producing that it's not producing, right? So, just like I was talking about vitamin D, genetically, if your body cannot activate or produce vitamin D, we give you activated vitamin D. Yes,
Yeah.
Tim, go ahead.
So along those lines, you're giving the body, giving the person what they need, personalized to them. So getting very personalized with it. And you touched on it earlier, but how do you get that? Let's dive in and tell people how they can get that genetic blueprint. You said if they've done Ancestry.com, it's another thing you can use that. But what are the tools you use, that and others, to kind of help people get that blueprint, the guide, guide the action that you take?
Yeah, so so we have the patients download the stuff. They can download it. They can email it to us. They send us directions. I can give my email with all the directions on how to do all this stuff if they want to get in contact with me or anybody else. But pretty much you would have to download your raw zip file and data file, and then you have to screen through your text file, look for everything. We use different softwares. We've created a software that actually will read it for us in about 10 seconds and give us recommendations. We're looking for some things. We use stuff from Pure Encapsulations. They help us out. There's a free one online also called Genetic Genie that you can use your stuff and kind of run it through there. Live Wello is another one. But you still have to be able to know what exactly you're looking for. And that's what's taken the longest time. And then from there is deciding what else can I do? What are the doses, the recommendations out there for the supplementation? How many milligrams do I actually need? And stuff like that, depending on my genetics. And that's where we come in as providers to try and help out our patients be able to get a blueprint of what they're needing.
Right. So the
There are
information.
some people, yeah, one quick thing.
Go ahead.
There's also people that don't want to do Ancestry.com or 23andMe because they don't want anybody else knowing their genetics, right?
Mhm.
Ancestry.com, 23andMe, they do sell your data to other parties out there. A lot of times they don't identify who you are as a person, but they're identifying this is how many people have this genetic issue and are having all these other problems, right? So we see that out there all the time. There's other ones that we can use. We have another company that we get, but we only get 5 actionable SNPs from there. It's very personalized. In order for us to get that information, you have to actually sign a waiver to release the medical information to us to get it. So that one's a lot more secure. The difference is you're going to pay a lot more money for it. It doesn't tell us the SOD2. It doesn't tell us production of vitamin D. It doesn't tell us your production of serotonin, right? But it does tell us just a complete methylation cycle. We can use that. And we do have some patients that want to go that route. And then we've had patients that have done all 3 routes just because they want to see if there's any differences.
Mhm.
And it actually comes back, no, there's no differences between Ancestry.com, 23andMe, the methylation that they're paying anywhere from ours is 300. I know there's other ones online that charge $600 for that same test. And so, but when it all comes back into it, it's like, it's the same thing. That's why I tell patients, I'm like, well, what can I do to change my genetics? And I'm like, your genes are your genes. We're not doing anything to change your genetics. What we're doing is we're just replacing what your genes aren't doing, and we're fixing that. So whether you have the right genes or the bad genes, we're fixing it.
Dr. Michael, is there a one-to-one, like going through your whole technology platform and everything, really analyzing someone's genetics? Is there a, answer for every deficiency, or is it a little bit of trial and error at some points?
Well, I mean, the ones we're hitting are the main actionable ones that we can look at, but there's not a genetic issue like, let's just say, like magnesium, right? There's really nothing out there in your genetics that are going to tell you whether or not you can process magnesium or not, because magnesium is just magnesium. Now, what makes the biggest difference with magnesium is the salt form, right? So if you have like magnesium citrate, you drink enough of that and you're going to be going to the restroom nonstop, right? And you're going to be cramping from that excess diarrhea.
What's the difference between magnesium citrate and magnesium glycinate and some of the other forms?
So The main one we use here is magnesium glycinate. It's absorbed a lot better, helps patients, go to sleep, helps them with their cognition, lowers blood pressure. Magnesium citrate, again, is more like in your gut. It's not very well absorbed. Another big one is magnesium L-threonate. That one helps cross the blood-brain barrier, so that's one that's very active in the brain. So we use that in patients that have, poor blood flow, because magnesium works as a calcium channel blocker, which there's medications out there like amlodipine that will do that. But you can get the same effect by using magnesium. And if we need to cross it into the brain to try and help relieve some pressure or help with migraines and stuff like that with some patients, we've been using that and had good success with that as well.
So from a practical standpoint, also, isn't magnesium good for preventing muscle cramping?
Yeah, for muscle cramping, we'll use a glycinate, but sometimes we'll use magnesium malate as well. And
there's
sometimes
also
we'll even, go ahead.
Oil
That you use in a topical form. Yeah, that will push through. The other thing too that we'll like to use is a combination of magnesium and potassium, and that also helps out with the cramps as well.
Okay, so so we talk a lot about spend this amount of time there on magnesium. In addition to that, then I think there's a case, a person you mentioned earlier, I think had anxiety and some other things you work with.
Mhm.
But you've worked with hundreds of patients, so hundreds of patients. Can you give us some examples of where you've gone through this process with them? You've done the testing, you've identified what they're lacking on, and then how it's really affected their lives, health.
Oh yeah, no, it's been life changing with some of these patients, and so yeah, once we've done the genetics, we've done it for probably over 1,000 now. We always tell patients, look, you only have to do it once in your life because your genes don't change, right? Now, we may look at other things. Maybe we're going to look at a different SNP that has more and more research on, and so we're looking at that now. But for the most cases, we tell them, like, well, you do this once, and we sit down with you for a good 30 minutes to an hour consult, explaining your genes and who you are, right? And then what you can take to try and help with those things. And then when you're starting to look at, patients like the one with the anxiety that would not leave her house, her anxiety is gone. She flew, so they're not from here, they're from El Salvador. And they went back to El Salvador where she wasn't able to do that for a long time. Then she started sending her kids, right? And she had her daughter. Her daughter had a miscarriage. Her daughter had hypothyroidism, ended up having the same genetic SNPs as her mom, treated her with the troche as well. Thyroid improved, pretty much normal now. She had her baby. She got pregnant and had a baby, which they told her she probably wouldn't have a baby, right? Their son too, hypothyroid. Just by giving him methylfolate and a combination of other methylate B vitamins, his thyroid is operating fine. We've had patients come in, some autistic children that are nonverbal, come in and you're giving them that with along with like glutathione, some other things as well. But usually adding in that methylfolate as well, they're like starting to talk. They're starting to be more social, right?
You have to love results like that, don't you? It's
Oh, I love
fantastic.
it. I mean, when I see them, just like, and then the parents are like, "Thank you so much. Like, my child is a totally different person. They're actually back to where they're where I see my other children, or they're where I want to see my child, thriving with this stuff." And like a lot of it's like, look, you didn't do anything wrong as a parent. This is just what happens in their body. And there's other things too, right? Some people talk about like environmental toxins, that they can be exposed to as well that can cause and trigger these issues. But again, a lot of it is going back to detoxification. It's like, okay, so how do we detoxify the body? And majority of doctors, medical professionals will say, okay, well, to detox, what do you do? And they're like, we don't know. I mean, we know it's a process, but we don't actually know how to address that.
So, Dr. Michael, I love that you address that it's not the parents' fault, that there is, there is some help there for them, but it's not their fault. They've probably been giving that child the best nutrition, best home that they possibly can, but there's just a genetic SNP there that doesn't allow them to properly absorb the nutrition that was needed.
Correct. Yeah. And some parents are very hard on themselves because they're doing everything they can. We have some patients, that are seeing doctors all over and they're doing all these different gut microbiome tests and they're doing, some genetics they're doing, some neurological, and then you go to traditional medicine and they're just putting these kids on different types of medications for their mood stabilizing, and it's like, I'm sorry, but your kid is not deficient in Abilify, or your child's not deficient in all these other antipsychotics. I'm sorry, they're not. Their body's deficient in something else, and let's address those deficiencies first. And when I talk to a lot of doctors and stuff, we'll talk about, let's say, blood pressure. I'm gonna bring blood pressure up for a minute. And a lot of times we're like, okay, well, what's their magnesium status? How much magnesium are they consuming daily? And they're like, I don't know. I was like, well, treat them with magnesium and see what happens.
Yeah, really.
And we've seen a lot of patients just with that, their blood pressure normalizes.
Yeah.
Right. Then the other one too is like, homocysteine. Okay, so you can draw homocysteine. It's a blood test, but we ask doctors, do you draw this? And they're like, no. Like, well, why not? They're like, well, because we were not taught that. And it's like, well, one, you're not taught that because there's no drug to treat homocysteine. There's a
Right.
B vitamin B complex that you can use to address a homocysteine, but there's no drug to treat it, right? And that's the problem with medicine for the most part, is that if there's no drug to treat it, we're not going to use it. Because when you talk about deficiencies with B12, right, microcytic anemias and stuff like that, what do the doctors say? Oh, I'm going to put you on cyanocobalamin. Why? Why cyanocobalamin? Why not methylcobalamin? One, because they're not taught about methylcobalamin, because cyanocobalamin is a drug, right? It's a drug. If you look at the FDA
That's
book.
their world. That's their world. That's who their education teaches them. Yeah.
And again, it's no fault of their own. It's just what they were taught,
Yeah. Yeah.
And
true.
so when we go back and we look at other things and we look at these patients and you start seeing how well they're thriving, I mean, that's what keeps me going. That's what helps me just like keep going. Who's the next patient I can help out? And we have patients that come in and within 3 months, they're just totally different people.
Good. Yeah.
Nice.
Awesome.
Really nice. Yeah, that's the value of what you do, is that you can actually help people identify what's naturally going on in their system. And oftentimes you don't need pharmaceuticals to correct what's a natural deficiency or some kind of breakdown in the system. You can identify that and replace what's needed, which is really cool.
100%. I think the way God made all of us, we're amazing automobiles. We're all Ferraris, but then we just put crap pieces in our engine all the time. I'm sorry. Our food is crap. The nutrition that we have, everything has so many preservatives, to make it, shelf stable and stuff. I remember when I was a kid, I mean, it's not to age myself, but I remember going to the grocery stores, and the grocery stores were nothing more than maybe 3 aisles, right? And now they're 40, 50 aisles worth of different types of food products, where back then it was like you had your canned foods, you had your dairy, which was like your butter, your cheese, you had your meat market that was in there, and that was about it. You saw very few packaged things. Like I remember our cereal was not even that packaged. You had peanut butter that you would eat, bread that if you didn't eat the bread within 3 days, it was gone, stale.
Michael, you look really good for 85 years old.
Thank you.
Well,
But I remember what a lot of that was.
That's because he's identified his methylation and he's taking the right nutrients for his.
I've identified my issues.
His body is working well.
All right. So
that's why I tell a lot of patients nowadays, I'm just like, our food is not what it was back then. Because we have patients that say, man, my mom didn't go through this. And I'm like, well, your mom's environment was different from our environment now.
Yeah.
Yeah. And we didn't have organic food 40, 50 years ago because we didn't need it.
We didn't need it. Everything was organic.
Everything was, yeah.
Right. Yeah. That's right.
Yeah.
Yeah.
All right. So
yeah,
now,
and so I mean, there's been stuff too that's been shown that the nutritional value inside of fruits and vegetables now compared to what they were in the 70s is totally different as well.
Yeah.
Yeah. It's efficient. Yeah.
So,
I do know that a lot
people.
of food tastes different. I just having this discussion with my wife here, where I can't find a strawberry that tastes like a strawberry anymore. so things like that. That all said, so we've kind of laid the foundation where we've gone through nutrients. What are they? How can they affect your health? And how can they affect how you perform? Talked about how you are able to baseline people with the testing and get the information you need for their their kind of blueprint, and been able to talk about some of the dramatic results you've gotten with autism, anxiety, high blood pressure, and other things with this. So let's go now to let's say someone wants to really get started with you. For those outside of Texas who want to engage with you, how can they do that? What are the practical steps, and how can you help them?
Yeah, so our pharmacy is MyNURX Pharmacy, MYNURX.com. Not the NuRx pharmacy that sells birth controls. That's not us. The reason I went with NuRx and MyNURX is NU is better. It stands for nutritional, right? So I'm all about the nutritional space of trying to figure out, okay, how do we fix the body from within? We're a compound-only pharmacy because I believe that everything that we need is on this earth. So we do a lot of hormone replacement therapy to try and help women and men, feel more optimized. So they can go to mynurx.com. There's a place to be able to book a consultation for genetics. They can click on there. They can also email me at Michael, Michael, at mynurx.com. That's another way that they can, get a hold of us to be able to, or for me to be able to do consultations with them. So outside of Texas, I can pretty much help as a health coach and as a holistic practitioner. I can help patients identify the things. And then if it need be, and we need a prescription strength product, we can also work with their providers and get them. We have a lot of providers that we're already working with. Then we'll have a network worth of other pharmacies. That's the plan right now, is educating more pharmacies to be able to do these types of one-on-ones with the patients in their community. Because I'm one person, I can take care of a lot of bit of people, but I can't take care of all the United States on my own.
Right.
And you need to be able to help patients and hold their hands and tell them, like, okay, let's go this way, let's go that way. Okay, let's decrease here, let's increase here. And I think that's where it comes back. You need somebody that really understands nutrients, nutrition. And so working with different pharmacists and providers out there, will be getting there hopefully soon.
Michael, if you could leave our listeners with like one piece of golden advice, what would that be? You can give them one piece of golden advice and one directive.
One directive. Okay. Man, I would say eat whole foods.
Okay, yeah, without labels.
Without labels and without non-GMO, if you can find all that stuff, just eat good raw foods. That would be number one. Number two, I would say, if you're buying junk supplements, don't buy it. You can even go onto our website. You can message me. And if you have questions on some supplements, I can tell you what to use, what not to use. We have little one-pagers. I just don't have a link for that one-pagers of different types of supplements to be looking for, the names to be looking for.
But that's great that they can get a hold of you to ask you some questions about supplements, because supplements are very confusing to almost everybody on the planet. And so to be able to email you, it's Michael at MyNURX.
Correct. MyNURX.com.
Yeah, and I know we didn't cover it on this podcast, but I know Michael, and he's disclosed to me that he has providers, so doctors that come to him for assistance because they aren't feeling 100%, and they know that there's something missing there. So walk us through, Dr. Michael, what the process or the timeline is for someone. So let's say from the testing to the interpretation to actually taking action. What does that look like?
So if a patient has already done their Ancestry.com, genetic test, that process, we could probably see them right now within a week, within a few days, just depending on the schedule, because we also have a clinic and being able to see patients, and we can see patients through Zoom virtually. That's not a problem. We have those capabilities. So if they haven't done their Ancestry.com information, that's going to take probably 4 to 6 weeks to get that sequenced out. And if they don't want to do that and they want to do the more secure one, they could reach out. What we have to do is we have the company ship the test to them. It takes about 1 to 2 weeks, sometimes 3 weeks to get those results back, and then schedule the consultation as soon as we get that set up.
And then is that just a cheek swab as well?
That one's a cheek swab. Ancestry is you spit in it, but the other one's a cheek swab that you do on either side. Very simple to do.
So what percentage of people who get their genetic testing done can you help through your analysis of the results that come back?
Well, pretty much everyone, but I will tell you, not everybody has a genetic SNPs. Like when my daughter had, she's like, I'm anxious all the time, right? And for her, she was, so pretty much we like to see everything as red, yellow, green. Green means you're good to go. There's no true genetic SNPs. Yellows, you're heterozygous, so you have one good, one bad. And then when you're red, it means you have both bad, right? So it's lower functioning. And I was expecting her to have some red stuff, but she doesn't have any red things, right? So all we did for her is we told her, okay, look, we're going to put you on a good dose multivitamin with a little bit of iron because, females a lot of times have issues when they're menstruating, having menstrual cycles, and then they have like, some anemias and stuff. And just by doing that, that helped her out, right? We didn't really have to do much of anything.
Fantastic.
But the thing is, it's one of those things, right? So people go on TikTok or, Instagram or whatever, and they're scrolling. They're like, oh my gosh, look, this person lost 40 pounds by taking berberine. But then you go and buy it and you're like, yeah, berberine didn't work for me. It's like, why didn't it work for you? Why? Because you didn't have the issue that was affecting that other person, which is usually your insulin levels, right? So it works as an insulin sensitizer. So this way you're not guessing about what you're taking. You're taking it because there's a measurable and there's something that you are feeling and you'll see the results.
So that's a strong point for people to get their genetic testing done so they have it and they can be used by experts like you, Michael, who can help them figure out what's going on. Because, there are a lot of people that have, what percentage of people that you see their genetic testing done have the SNPs and have different?
Oh man, I would say honestly close to the 40-50%.
Okay, so
yeah. And a majority, and so there's different ones, right? Because also when we talk about methylation cycle, we didn't talk about this one, is a COMT SNP, right? And a lot of patients, when they have this COMT SNP, believe it or not, these patients tend to be very OCD. If anything comes outside of the norm, it breaks them. Like they cannot handle stress, so they don't work well in stressful situations. Where other people work great in stressful situations, actually, those tend to be your procrastinators. Those patients, they're like, I'll get to it sooner or later. And under stressful situation, they're more focused, right? And even some of these people are like your military people or even your SWATs and stuff like that. You'll see because they work great under stressful situations, right? It's very interesting when we start looking at those other genetic things and you can be like, okay, so I see this genetic issue. And this is before we were even talking to some patients, right? So we'll be like, okay, so I had this genetic issue. Do you experience, these personality traits and stuff like that? And they're like, yeah, this is exactly the way I am all the time. Like, yeah, because it's your genetics here. Your body's creating thought and it can't break it down, but we're going to help you be able to break down those thoughts to slow down your mind and get you to a better spot.
Well, this is a topic for another episode for sure, but why is it that somebody that wants something in a specific order is called a disorder, right?
Very true.
I might sympathize with that statement there a little bit myself. But hey, thank you so much, Dr. Michael, for kind of sharing that there is a personalized approach, and it's not just buy a supplement and hope for the best approach. That model doesn't really work for us. And before we close out today's episode, I do want to thank again our sponsor, BioLite, also Brain IQ. If you're tired of painful injections and expensive prescriptions and you want to still lose some weight, but all naturally, you might want to give Brain IQ Fast Melts a try. This is a revolutionary way to shed pounds easily. It's less than a fourth of the cost of traditional GLP-1 prescriptions. You can lose up to 28 pounds in just 10 weeks with no side effects, again, all natural. The leading prescriptions take 40 weeks to get similar results, but of course, they have some side effects you need to be aware of. So outperform the leading GLP-1 prescriptions, lose more weight in less time, say hello to a faster, safer, smarter way to reach your weight goal. So don't wait. Choose Brain IQ Fast Melts and start performing and outperforming the prescriptions and transform your body today. So we'll leave a link in the show notes for that as well. So in closing, again, thank you, Dr. Michael. It's been great to have you on today and for helping us understand nutrients and what they really are and and how genetics can be so important to our individual bodies and how we're made up. And so, I appreciate you talking about addressing those gaps for us too. So Dr. Michael, again, thank you for being our guest today.
Oh, thank you for having me. I've had a great time talking to you, Tim, and you, Dr. Bob, as well, and you, Breck. Very good. I enjoy giving this knowledge to patients and being able to help them understand, like, look, it's not your fault. That's help fix you, optimize you, and get you to a better spot. And any way we can help to improve their health is what we're here for.
Right. And that's just very, very good information that you provided. And it really, struck a light with me that people can do everything right. They could be eating well, they could be exercising well, they could be working with their doctor correctly, and it still might be off. And that just might be genetics that is doing it. And so therefore engaging with someone like you can help them analyze and get through that's just very key and important.
Yeah. And to our audience, go ahead, Tim.
I'll just say that might just be that missing link that people keep looking for.
Yeah, thank you. So to our audience, if you found today's discussion valuable, please subscribe to the Wellness Wave Club YouTube channel. You can also join us in the Facebook community as well. There's great resources there. And please share this episode with someone that is close to you that could use this information and help them in their health journey. Your genes may hold the keys. And so understanding them is the first steps to your path to wellness. And it can start right here. And we want to help you along the way. And always remember, wellness, it's in you.